Wentworth Healthcare is a not-for-profit organisation and we're the provider of Nepean Blue Mountains Primary Health Network. We have a really clear vision, and that is to support the health and wellbeing of all the people living within our region. There's three main ways we work. One is that we support general practice to provide high quality care to their patients. We commission or fund services that meet the needs of the community. And we work with others to integrate care to make sure people don't get lost in the system when they move from one part to the next.
When I started my practice, I was starting medically, but I wasn't sure about the procedure, how to do the accreditation and how to do the vaccinations. Nepean Blue Mountains PHN were very supporting. Without the help of PHN team, to be honest, I wasn't going to be able to survive. I wasn't able to be aware about all this process.
So we help general practices and GPs like Dr. Yusuf in many different ways. It could be through supporting them to be accredited as a practice. It might be helping them with information like the latest information on immunisations. We help them navigate a whole lot of pathways that they need to know about to provide the best support for their patients. Really essential to what we do is knowing our region and knowing the primary care needs and working collaboratively with consumers and healthcare professionals to help identify what are the gaps and what are the solutions that we need to design together. We heard from the community of Lithgow that they really needed to get some more mental health services in the region. So we worked with the community, with council, with government and advocated, and we were able to fund a new headspace. We work really closely with lots of health professionals like allied health, nursing, hospital doctors, GPs, ambulance services to really try and integrate and join up the health system so that people don't fall through the gaps when they're moving from one healthcare provider to the next. Health pathways and the use of My Health Record are examples of work we're doing to really try and join the health system up. One of the areas I'm really proud that we work on is advocating for the needs of those who often others forget. Disadvantaged communities, people who may be isolated, and Aboriginal and Torres Strait Islander communities. A lot of what we do is behind the scenes, but I think that nearly every single one of our 360,000 residents would come in touch with some of our work every single year. So that might be by attending a service that we support, it might be attending a general practice that we support with quality improvement, it might be as simple as being able to go and get medication at 3 a.m. for their sick child because we've supported a pharmacist to remain open. I'd really encourage people to visit our website and find out about the services in our region, as well as how we can support health professionals and the community.